Tēnā tātou katoa, good evening. A leading public health specialist says too many of us have stopped using masks indoors, when putting them on should be second nature, like wearing a seatbelt. Professor Chris Bullen from Auckland University is concerned about the rising number of people in hospital. 689 today, the highest in 3 months, with 13 in ICU. There were 17 deaths reported today. That's also the 7-day rolling average, which is up 3 from the same time last week. And there are 8,395 new cases in the community, up almost 2,000 from last Monday. But Chris Bullen says the trouble is the government isn't ramming home the message about masks enough. Adam Hollingworth reports.
2 years of masking up and many of us are over it.
Yeah, definitely over it. I think, hopefully they can get rid of it soon, because it's like, especially in school, I just don't like wearing it and going around town, it's annoying, yeah.
In Auckland's busiest shopping areas, a smattering are still wearing masks.
Probably they will give you a bit of confidence, I don't know, mentally. But is it protecting you 100%? I'm not 100% sure, to be honest with you.
But as the number of hospitalisations increases, there's a stark warning from a public health specialist that the system is being overwhelmed and dumping our masks is wishful thinking.
It's not all over. We can't go back to life as we used to live it. We have to suck it up. And it's just like wearing seatbelts or putting a crash helmet on. We've just got to incorporate this into our daily way of living, I think.
In the era of the daily news conference, the mask message was constantly reinforced. But Professor Bullen says now there's a vacuum.
I'm concerned that it's been fairly quiet and quieter than it should have been. So I'd like to see much stronger leadership from the top around mask wearing and see that being modelled in appropriate situations as well.
COVID-19 response minister Aisha Verrall knew very well the importance of masks when she was campaigning for a Labour list seat a couple of years ago.
There shouldn't be any gaps.
But she was sick today. But if you're looking for a decisive message on masks from the main opposition party, think again.
Yeah, sure. But I mean, let's do a dispassionate risk assessment of exactly what's changed, and let's work out what we need to do, and let's be really clear about communicating it to the New Zealand people. If we think we need to change the masking rules, and we agree that that's the right thing to do, and the health advice is saying let's do it, we should certainly look into that.
No one likes wearing masks. They're inconvenient and uncomfortable. But experts are saying harden up. Right now, what we put on our face could keep the country on its feet.
Kia ora, Adam. There's a call for more leadership. What's the government's response?
Sam, Dr Verrall was sick today, but she did release a statement saying that she and other ministers frequently, if not every day, speak about the importance of mask use. She also says that they do model good behaviour. And she says a new campaign about mask use is about to be launched. But she does acknowledge that there has been some drop in mask use in some settings in some parts of the country. And an announcement on that is expected shortly. However, I guess we'll have to wait till she gets better to find out exactly what it is.
Tēnā koe, Adam. Thanks so much.